Hi, I'm Dr. Suraj Chiraniya, hematologist and BMT physician practicing in Mumbai. Welcome to our channel. Today we will discuss what is the latest treatment for multiple myeloma, outlining the latest drug and their effects. So multiple myeloma is a type of blood cancer. It requires quadruple or triplet regimen depending on the risk category to get a better control over your myeloma cells. As we know, multiple myeloma is not a curable as of now, but it can be controlled so that relapses, when it happens after a long time, and you have a better quality of life in between. So the treatment option depends on the risk category of myeloma patients. Usually we classify the risk category as a standard risk and high risk. Usually standard risk is treated by triplet regimen and high risk is treated by quadruplet regimen. So the drugs what we give are mostly four types. First drug is proteasome inhibitor, Velcade or bortezomib. Second, immunomodulatory drug, we called it as lenalidomide or imid. There are second generation like pomalidomide drugs are also falls in this category. Third drug what we use is steroid, dexamethasone or prednisolone. Mostly we use dexamethasone. Fourth drug is immunotherapy. Immunotherapy mostly commonly used is anti-CD30 directed immunotherapy, Darzalex. So friends, as we discussed, standard risk category is treated by triplets consisting of regimen we called in short form as VRD. VRD means V stand for bortezomib, Velcade, R for lenalidomide, revolutionize, D for dexamethasone. So how these drugs act? First drug, bortezomib. Bortezomib is a targeted medicine. It causes apoptosis of cancerous myeloma cells by programming their protein to stack inside these cancerous cells, leading them to death. Second drug is lenalidomide. Lenalidomide, it changes the microenvironment present in the bone marrow so that this microenvironment leads to the enhanced immunity that leads to the death of these cancerous cells. Third most important is immunotherapy. Immunotherapy, what it does, it activates your immune cells against the cancerous cells. So these therapies has a least side effects and most prolonged effects against the cancerous cells. Fourth is steroid. Steroids acts by killing the plasma cells because plasma cells are very sensitive to the steroids. These are the four most common category of drugs what we use. Coming to the newer drugs what we read about and currently going on the trial, there are two drugs. First is bispecific antibodies. Bispecific antibodies, what it does, it brings the T cells nearer to cancerous cells. These T cells become cytotoxic and release cytotoxic material inside the cancerous cells, leading to the death. So this therapies has a least side effects and more prolonged effects. Second, the latest is CAR T cell therapy. In CAR T cell, body's own T cells get transformed in labs so that they specifically kills these cancerous cells. So these two treatments are very exciting, will be very important prospect in treating and curing multiple myeloma in future. These two treatment options currently are not available in India or are available only on compassionate on trial basis, but by the end of this decade or early part of this decade they will be at a very cheaper cost and maybe commercially viable approach, they will be available in India. That's all for today's videos. Till next video, stay tuned, stay informed. Thank you.